So we found out that I had endometriosis, and well, after that they took it out and they said, okay, about 6 months you have to get pregnant in that time, and we still didn't get pregnant. And that's when we decided to look at the fertility treatments.
I considered doing the fertility treatment in South Africa, but to get leave and the accommodation, everything held me back. And then a friend told me that they actually have the IVF clinic here in Namibia.
For establishing our own clinic, we can do in vitro fertilizations here. We can freeze embryos, we can do frozen embryo transfers.
After everything, we decided, okay, we're going to go for IVF treatment, and then we decided on the Windhoek IVF facility to do our treatment with Dr. van der Colf.
In vitro fertilization is where we stimulate the female, aspirate the follicles, get the ova or eggs, put the prepared semen with the eggs, wait for fertilization, and when the embryo reaches a certain stage, we put the embryo back intrauterine.
To me, the only painful situation was when they did the extraction of the eggs, and that's more uncomfortable. The implanting, none of that was painful at all. We went for our first blood test to find out if we were pregnant 10 days after the insemination, and then the second blood test was 14 days afterwards, and then they could look at the levels and see, yes, we were pregnant.
I think most patients usually wait too long. I think our biggest enemy is age. As a rule of thumb, if patients try to get pregnant and they're not pregnant within 6 cycles, then they definitely need a referral. We won't necessarily start treating them with IVF, but at least we can give them a plan of what they need to do. It differs. If a patient is 23, then we will take a bit longer and go slower. But if she's already 35 or 36, then we won't have a lot of time to play with.